Hey everybody, welcome to the Crohn's Fitness Food Podcast. I'm your host, Stephanie Gish, Crohn's warrior and IgA nephropathy warrior, and I'm dedicated to sharing the stories of those with IBD. Thank you so much for joining me today. Now let's get to it. Well, hi everyone. My guest today is Dr. Natalie Scheeler, a naturopathic doctor specializing in integrative treatments for gastrointestinal conditions. Much of her practice includes inflammatory bowel disease and functional GI conditions, and she's here to share her perspective on gut health and valuable insights. Thank you so much for joining me today, Dr. Scheeler, and welcome to the show.
Thank you so much. I'm so excited to be here.
I'm excited to have you. So typically when I interview guests, they are patients, and I like to ask about their IBD journey. So I thought we could start off in a similar fashion with your story, but rather than a patient story, can you share your journey to what led you to become a naturopathic doctor and why you chose to specialize in gastrointestinal conditions?
Yeah, absolutely. So I always knew I wanted to be in medicine. I was kind of one of those classic young people who wanted to help people and they were into science and health. And so when I was in undergraduate, I worked as a medical assistant in a primary and urgent care clinic in DC. And I was part of a program where I worked as a medical assistant, but I also got to go in to the visits with the doctors and shadow and learn from them. And that was my first real experience of what the reality of healthcare looks like in the United States outside of what is portrayed on Grey's Anatomy and House and things like that. And it definitely was not what I expected. We had a large population of people who had chronic diseases, things like high blood pressure, diabetes, chronic pain. And just due to the nature of the system, the patients and the doctors spent very little time together. And so not a lot of treatments were offered outside of medications. And so oftentimes we would send people home with these drugs. They'd come back weeks later, either not feeling well, side effects from those drugs, or not any better. And then leading both the patient and providers to be frustrated, doctors wanting to help, but just not having the tools or the time to do so. And then patients obviously frustrated because they're not feeling good. So that led me to try to dig a little bit deeper of what else was out there. And so a few late night Google sessions later, I stumbled across naturopathic medicine. And I immediately fell in love with our naturopathic principles, our kind of guiding principles and that holistic perspective. So long story short, started working with a naturopathic doctor, ended up in naturopathic medical school, and then here I am today.
And what about the IBD connection? When did you really start specializing in not just IBD, but gut health and inflammatory bowel diseases and other gastrointestinal conditions?
Yeah. So I knew I wanted to focus on gastrointestinal conditions in school. I personally have had IBS since childhood, worsened in college. So I was always interested in the GI system. And then during my residency, I got to work with Dr. Mark Davis, who is a well-known naturopathic doctor who focuses on inflammatory bowel disease. And learning from him and getting to work more directly with more IBD patients, I kind of fell in love, I think, with IBD. I'm sure that you're familiar, is that some of the tools can be really helpful, but there can be limits to the tools. They don't work for everyone. And I think natural medicine, naturopathic medicine has a lot of additional options for tools that can be super helpful. And so it's very rewarding being able to offer people those tools and offer people another option for hopefully getting better. And so that's how that all started.
Thank you for choosing the path to help us all heal our guts
That's the
and feel
goal.
better. So, for listeners, can you start us off by sharing a little bit about what the difference is between a naturopathic doctor and what we know as a traditional MD?
Yeah. So as naturopathic doctors, I mentioned before, we have a set of principles that kind of guides how we treat our patients. We focus on preventative medicine and what we call root cause whole person approach. So we try to address things that are causing disease or contributing to that disease. And we look at it through a lens of the whole person, understanding that all of our systems work together. So for somebody with inflammatory bowel disease, obviously the gastrointestinal tract is a large part of that. But we know that the GI system has effects on other systems in our body, and then as well as the medications we take for that. And so that's really looking through that whole person lens. And so as naturopathic doctors, we are trained in those conventional therapies like medications and pharmaceuticals. We also have that in integrative training. So things that we are trained on is nutritional medicine, physical medicine, botanical medicine, lifestyle medicine. So we can use all of those things depending on the patient and the situation, depending on what is best for them. Mm-hmm.
I love that. And do you go to a specific naturopathic school or medical school?
Yeah, so similar to our conventional counterparts, it is a 4-year postgraduate doctoral degree. And we do start off similarly in training like MD or medical doctor, DO, osteopathic medicine schools. Those first 2 years are the clinical sciences, so the anatomy, physiology, biochem, diagnosis. And then second 2 years, we do in clinic as well for that hands-on experience. We just have those integrative therapies built in on top of that. One of the major differences is that for NDs, we are not required to have residency like MD and DO schools are. Unfortunately, we're not subsidized by the government, so it's hard to offer those programs for every graduate. And so some people do them. I did 2 years myself, but they're not required. And then as far as licensing rights, it depends on the state of what that looks like. So certain states that we are allowed to prescribe, and there's certain states that do not allow that.
Thank you for taking us through that.
Yeah.
So as I mentioned earlier, you specialize in the gastrointestinal conditions, and you have various integrative treatments for those. So can you talk about what some of those treatments are and how they might differ from the standard protocols that we as patients might be used to, such as immunosuppressants and biological medications?
Yeah. So I kind of separate them. So we do have integrative treatments that are effective for inducing remission, maintenance of the IBD itself. And so those things can look different. Sometimes that looks like herbs. We can do support nutritionally. Other options too, so things that we can probably talk about today. Fecal microbiota transplant is something that I commonly do with my IBD patients. And then Helminthic therapy, also something that we do with our IBD patients. And then on top of that, treating the IBD, getting somebody into remission, maintaining that remission, we do have treatments for kind of everything else. So if somebody is using, say, steroids, how are those steroids affecting you? I think I was listening to the podcast with Logan Crumrine, and he was talking about how he was concerned with the long-term prednisone use and concerned with blood sugar and having difficulty with that. That's kind of a perfect example of something that we could help support. We look at the blood sugar and then maybe bone density and things like that. So we have kind of two areas there, the direct treatment and then everything else.
So when you work with IBD patients, are some of them still going through a more traditional route, like on biologics or immunosuppressants, and then you support that? Are you working with that side of the team as well to make it a whole approach?
Yeah, absolutely. So generally speaking, the two situations that I have is that people come to me, they've exhausted all of the conventional options and aren't getting that desired response that they're looking for, and so are looking for anything else that they can try. And then there are certain patients who have kind of just a natural bias to wanting to do natural medicine. Always, 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 I do require that somebody work with a gastroenterologist. We aren't a replacement for the gastros. They do obviously important things like scoping and stuff that we can't do. That's an important part of that disease monitoring. So goal is to work synergistically with them. But yes, we do support that.
I love that. And I love that you bring more options to the table for
Mm-hmm.
patients. So let's talk about fecal transplants for a minute. Fecal transplants is something that I actually learned about. I've never done it, but I learned about it years ago when I, like many of my listeners probably, have gone down many a rabbit hole late at night. And so as I was researching gut health and different things I could do to help mine, I came across fecal transplants. So can you talk about what they are, how they're used, when you use them, in the clinic and any research behind it?
Yeah,
Just
absolutely.
everything and anything about fecal transplants.
I'll just start word vomiting. Yeah. So essentially, broad overview, what FMT or fecal microbiota transplant is. It is taking the stool from a healthy person and transplanting that into another individual with the goal of reintroducing those beneficial organisms into the gut. So with inflammatory bowel disease and some other conditions, but specifically inflammatory bowel disease, we don't know the specific cause, but we know that there's that interplay between the genetics, the immune system, and the environment. And that environment includes the microbiome. And the microbiome and our immune system have a very intimate relationship. And what our microbiome looks like affects how our immune system responds. And so when we do FMT, we try to reintroduce some of those beneficial organisms that we know help support that healthier immune response. And so as far as what that looks like in the States, so right now FMT, which you probably found it in that research, is only approved for treatment-resistant C. diff, C. diff being an infection that can cause diarrhea, inflammation in our colon. And so to be able to get that in the United States from a stool bank or a regulated stool bank, or there are 2 prescription products that are available now, you have to meet that criteria. Treatment-resistant C. diff, meaning you have C. diff infection, you took the antibiotics for it and didn't have appropriate response. And so that's obviously very limiting. So what it ends up looking like is if somebody with IBD wants to do FMT, they're doing it on their own. They're finding a donor by themselves that they may know, and then doing the process at home. So where I come in is try to help that increase the safety, reduce harm there. So I can help with the screening process and then help with recommendations for what the treatment process looks like as far as frequency goes, timing, size and method, etc. So that's typically where I come in. When for IBD, there is research to support the use. For ulcerative colitis specifically, as far as research we have right now, about 25 to 35% of people who do the FMT have clinical remission compared to placebo. And then for Crohn's disease, that number is actually much higher. It's at 57%, which is pretty significant. And I can share these studies with you if that's helpful for show notes or whatnot.
That'd be great.
Yeah. So I'll send that your way. But one of the major factors of those studies is that with FMT, they're typically doing FMT by itself because it's how we like to do studies. We make one interventional change so that we can really have a better understanding of cause. That's not necessarily how we have to do it in the real world. So we could consider combining it with other therapies there. And then typically with the studies, the frequency is a little bit lower than what we do in at-home therapy. So usually in the studies, it's either one or a few treatments versus at home for inflammatory bowel disease. I typically recommend starting with 10 treatments consecutively, semi-consecutively over about a 14-day period. And so sometimes how we do it in the quote unquote real world outside of studies can offer even more benefit because we're tailoring it a little bit more to the individual versus kind of keeping it in that sterilized study.
Is there anything on the horizon for FMTs to eventually become a standard practice other than used just for C. diff infections? Is there anything in the works, any legislation, or how does that change or become?
Yeah. So there's currently studies being done now for patients with inflammatory bowel disease. And that's the goal. There's several companies that are trying to come out with products that can be prescribed for inflammatory bowel disease. With the C. diff, it is a little bit quote unquote easier because we generally require less. You usually use one treatment to have that clinical benefit. And that's not always the case for inflammatory bowel disease. That's seldom the case. Usually we need more treatment. So it's a little bit harder to have a kind of a standard of care with the C. diff prescriptions. There's 2. So there's an oral capsule and then there's a rectal suspension. And so with that with the rectal suspension, you do it one time, go into the office, do it one time. The oral capsules is for 3 days. So, and then you're done. It's harder with inflammatory bowel disease because that usually looks longer. So that's kind of something that's to be figured out. The other thing too is since those two products, they're called Voust and Rebiota, they are FDA approved for that treatment-resistant C. diff, but a provider could always prescribe off-label. The issue with that off-label prescription is that insurance will not cover it, and those can get pretty expensive. And then you, as far as having enough to get to that therapeutic dose for inflammatory bowel disease, it's probably not. So it doesn't always make the most sense to do.
So when I researched some of this many years ago, I was starting, this is when some of those like at home, like stool sample tests were coming out, and they would give you like the whole breakdown of, you know, your probiotics and the bacteria that's in your system. And I noticed when I did that, and this was years ago, so that's why I'm not remembering well, but but I know there were certain bacteria that are more commonly found in patients with IBD. Is that something that you can share a little bit more about?
Yeah, so there are certain patterns that we see in people that have IBD versus kind of general population as far as the composition of that microbiome. However, we're still very early in the microbiome research. So it's harder to say. What we do, which is pretty clear from the research, is that a diverse microbiome is beneficial. And so that's when looking for donors, that's typically what we're aiming for. So somebody who is generally healthy, having a bowel movement every day, and then is eating food that promotes a generally healthy microbiome. So whole fruits, vegetables on a regular basis. That doesn't need to be some person who's keto, working out 5 days a week, doing all of these intense things. But we do, so that diversity is one thing that we do know. The kind of difficulty with picking out certain bacteria is, as far as studying the microbiome in our gut, it's really hard to do. So the large part of our microbiome is in that large intestine or colon. And so when we're referring to our microbiome, we're typically talking about that colonic microbiome. And there is no oxygen. So most of the bugs that are in our large intestine are anaerobes, meaning that they don't use oxygen, and that oxygen can harm them. And so when it's difficult to test and figure out exactly what's in there and how it's functioning with that anaerobic environment, because we can look at the stool and physically see what's there, but it's hard to know how that actually functions in the bowel when they are in there. So hopefully that's what people are researching now. That's the research we're getting, but we're still in that infancy stage as far as microbiome goes.
That is a whole lot more information than what Google told me.
Yeah, it's definitely complicated.
Thank you for taking us through that. And I never thought about the research side of it. I never thought about trying to get those anaerobic microbes into an environment where the minute you bring them out, they're exposed to oxygen, and trying to do the research and figure that out. So
another thing that we are kind of looking at now and starting to recognize is that we used to kind of think of it as quote unquote good bugs and quote unquote bad bugs. Things like C. diff is a bad bug. We don't want it ever. What we're seeing is that C. diff can be part of people's microbiome, and they are okay. And so it's these balance and the interplay, and that there can be a little bit of a spectrum of, okay, it's present now and it's not an issue, but if some things were to change, it could become an issue, not an issue. So things are a little bit more gray than we once thought.
Well, the microbiome is definitely an exciting field of research, I think. And like you said, it's just in its infancy. So it'll be really fascinating to see what another 10, 20 years brings with microbiome knowledge.
Yeah, absolutely.
So you mentioned food and some of those bacteria that are in the gut. So as an IBD patient, I've spent a lot of time focusing on food myself.
Yeah.
How do you think food impacts IBD, and what role do probiotics have in a diet for someone like me with Crohn's or other IBD patients?
Yeah, definitely. So I think we are now all starting to understand how big of a role diet can play in IBD. Both patients probably have known that for a long time, providers starting to get on board with that more. So that's absolutely something that we work on. I think one of the things with diet is there are certain diets that have been studied and they show benefit in inflammatory bowel disease. So that's things like the specific carbohydrate diet or elemental diet, things like that, that is typically where we can talk through with patients. The one thing I always like to consider with patients is that diets can be super restrictive and challenging and have an added stress. And so that doesn't always make sense for everybody. Generally speaking, we do like to promote things that would promote a healthy microbiome, like the whole foods and lean proteins, things like that. But it doesn't necessarily need to be this restrictive diet. And that's not always the best case for all people. So I do like to mention that because in the integrative world, that sometimes can get forgotten. So just like to point that out. But second part of your question, as far as probiotics. So probiotics are definitely something that we can consider with inflammatory bowel disease too. Unfortunately for Crohn's disease, there's less research supporting use of some of the probiotics. So for ulcerative colitis, bifidobacterium and lactobacillus at high doses have been shown to have benefit. And there, for Crohn's disease, we don't see that same response. So typically not my first go-to unless somebody has taken them on their own and had some benefit prior, and then kind of reconsider that. There are other probiotics that I will still sometimes consider with Crohn's disease that you might have heard of, Saccharomyces boulardii or E. coli Nissl 1917. If any of those sometimes will come up with the Google searches, and I get asked about them, and those can be helpful for diarrhea. Again, the research is unfortunately mixed for Crohn's, but as far as if there is that kind of IBS on top of IBD picture, those can be helpful tools, just not as exciting of a tool for me personally for the Crohn's disease as far as maintenance remission.
And there are some patients that have IBS on top of IBD, so it's always great to have as many tools as we can to fix
absolutely
whatever's happening.
And in those cases, definite probiotics can be helpful tools for sure.
So you've seen a lot of IBD patients. Are there any trends that you've noticed in your practice with regard to what helps people get out of flares and maybe into remission?
Yeah, well, I think so. There's a few things. I think with the small molecule drugs, those JAK inhibitors, those have been really helpful, especially UC.
And can you touch on that real quick? Because I had an interview a few months ago. Someone mentioned JAK inhibitors, and that was something that was somewhat new to me. I've not kept up with the latest research in drugs, but it sounded like it worked differently than, say, some of the other biologics. So I was wondering if you could talk about what JAK inhibitors are.
Mm-hmm. Yeah, and so they similar to, so biologics were that new drug, and biologics are kind of based off living organisms, and so our bodies can respond to them because they can look so similar to our own, or they are derived from human cells, and so we can have a reaction and not tolerate them. Small molecules, they still are, as far as their mechanism of action, are involved in different parts of suppression of that immune system, but they are chemically derived and they're smaller, so they typically don't have the same response from our nervous system, negative response from our nervous system if we were to react. So we don't typically react as much to them, which is helpful. And so those have been introduced and people have started to see benefit. We do see a little bit more robust benefit in the ulcerative colitis community compared to Crohn's disease, but there is benefit in Crohn's disease.
Interesting. Thank you.
Yeah.
So if I didn't derail you from where you were going with that first answer, talking about the trends of what you've seen with helping people to maybe get out of a flare and into remission?
Yeah. One of the trends, so I will say we kind of touched on this already, but the dietary aspect is a large trend I'm seeing, I think, too, with social media. There's just the ability to spread so much information. And so that is oftentimes now people coming into our office and have said, I've tried these diets or I've done these diets, versus us kind of introducing them to that idea. So that's interesting. The other one is an herb called Qing Dai. It's a Chinese herb. It's also called Indigo naturalis, another name for that, which is an herb that can be really helpful for inducing remission, typically. We usually reserve it for remission induction versus maintenance therapy because there are some safety risks to that. And I am excited about this because it is an herb that I really enjoy using. I actually co-wrote a paper on it. But what I am seeing is that there are some kind of online companies who are providing Qing Dai, kind of like a take this quiz and we'll recommend these supplements for you. And which I think it is good and bad. I think more visibility to Qing Dai, more use of Qing Dai can be positive, but I would always recommend working with a provider who's familiar with that herb. Oftentimes patients too don't even know they're taking it. They'll say, oh, I'm going to this place. I just started their program with these natural supplements, and it's 6 weeks, whatnot. Do you know anything about that? And then I'll look it up and look at the proprietary blend and see the herb in there. So that's become a little bit of a trend that's both, I guess, positive and negative. And I think too kind of highlights that something that's important to say is that natural medicine isn't always safer, and it isn't always safe in general. There is risks associated with any treatments that you do. And so knowing those risks, having somebody who is familiar with those risks is important, especially too if you are on the kind of quote unquote conventional medications and add this stuff in, there could be interactions and things too.
I agree. You definitely want to do that under supervision with someone like yourself.
Yeah. Mm-hmm.
And if you can share that paper that you wrote, I'd love to put that into the show notes as well.
Yeah, totally. Absolutely.
I'm sure a lot of listeners will be interested to learn more about Qing Dai.
Yeah, perfect. Exactly. Indigo naturalis is the other name, which might be a little bit easier. Indigo, that's where we get that. It's that blue. It's a blue shade. That's where we get that color from.
Okay, interesting. Yeah. So a few months ago, I actually had an ulcerative colitis patient on the show talk about her journey, and she mentioned Helminthic therapies. And that was the very first time that I had ever heard about that. And so I know that you use that in your practices on occasion. So can you talk a little bit about what the Helminthic is and when you use it?
Yeah, absolutely. So helminths, they are worm-like.
So I said it wrong.
No, so you said it right. So it's Helminthic therapy, but we're using helminths for it. So
okay.
Yeah. So helminths are worm-like organisms, and so they're typically referred to as parasites. Parasites imply harm. By definition, what a parasite is that there is something that is benefiting from their host and causing harm to that host. However, we see with helminths that that is not always the case. There can be what we call either a commensal, meaning the helminth benefits and the human is not harmed, or a mutualistic, the helminth benefits and the human benefits relationships there. And so there are absolutely parasites. This is not pro-parasite at all. We want to be cognizant of that. But knowing that there are some that can potentially provide benefit. And so we have identified 4 of these helminths that can be used for potential benefit in patients. And so that's something we do. It's similar to the FMT, that there's a little bit of that effector. But generally speaking, when patients get going on it, it becomes normal and they're totally cool with it. One of the benefits with the Helminthic therapy is that it is, depending on which helminth that we use, it can be very low maintenance. And so only having to what we call inoculate yourself every 6 months or so. And so it can be a very hands-off versus sometimes people end up being on however many supplements or drugs and handfuls that they're taking it every day and strict diet and things like that. And so this, depending on somebody's response, can offer an alternative that isn't as intensive. But that I should point out, typically with helminths, we're not or using it for induction, remission induction, it would be something to support a flare. Support maintenance. It takes time for these to work. So it's not something, if you were to come in and be having pretty significant symptoms, that I'd be like, okay, let's do Helminthic therapy. This usually takes 3-6 months longer for benefit. So it is something that takes time and not an immediate benefit there.
How long has the Helminthic therapy been around, and is there research growing around it?
Yeah. So as far as helmets have been around for tens of thousands of years. With that, so in the kind of 18th, 19th century, as we started certain practices, things like wearing shoes, having flush toilets, having antimicrobial, anti-helminthic drugs, we lost a lot of those helminths that were once, back in the hunter-gatherer days, a normal part of our microbiome. And so with that, when we lost them, we have seen a increase in things like autoimmune disease, allergy, inflammation, all of these kind of immune-related diseases. And so you may be familiar with the hygiene hypothesis, which kind of states is that when we are young and we're developing, that certain exposures to microbes can help our immune system to develop and promote what we call self-tolerance, for our immune system not to attack ourselves or not to have an inappropriate response. And with the kind of Helminthic therapy, that hypothesis has continued into what we call now the old friends hypothesis. And it's not just any microbes that help inform our immune system, but specifically the microbes that have been around for a very long time, since the hunter-gatherer times, when our immune systems were developing, and that our immune system and these microbiomes developed together. So those specific microbes being important for the training of our immune system. So the thought process there is that as we introduce these helminths, that we are helping restore our microbiota to a more diverse, what we know is a good thing. And then specifically, we do know that these helminths help increase our T regulatory response. T regulatory cells, or Tregs, are a cell of our immune system. I kind of compare them to the manager of the immune system. They tell our immune system when to stop responding, help with that, not creating an exaggerated immune response. So they help increase those Treg response. What the helminths produce substances to protect themselves. That keeps those Tregs from, that helps the Tregs to keep that immune system balanced, because that helps them survive so that the immune system doesn't attack them. But then it also ends up potentially helping those who may have conditions with lowered Treg response or inadequate Treg response there.
That's interesting stuff.
Yeah. And there is research. So unfortunately, with the research with helminth, is that it's not as exciting as some of the FMT research we talked about earlier. There is quite a bit with Crohn's disease. The issue with studies is that they are typically either 12, so 3 months, or 24, 6 months long. And there are some that show benefit with Crohn's disease maintenance-wise. However, these studies are short when we're talking about where we really get efficacy with Helminthic. So they're not as exciting and shiny as some of the FMT studies are. And hopefully with time, we'll get longer term studies. The issue with longer term studies is that they're expensive. And so it's hard to get those funded. And with helminths, hard to create a drug from that would profit and balance the cost. But what is interesting about helminths is there's a really large self-treating community. And so they put out a lot of information that is super helpful for people who are interested in and kind of learning more about it and sharing experiences through that way, and are a large part of what is driving the research forward.
And then hopefully as they learn about it on their own, they come to someone like you for a supervised Helminthic therapy protocol.
Yeah, exactly. And that is to say it is not riskless. So that it is something that you want to make sure that you're well informed. You're working with a practitioner that's well informed. For example, so when we inoculate with these helminths, there is a transient or short-term increase in our inflammation or immune response. When we do inoculate it, that's part of the normal process. The concern would be is, for example, somebody with Crohn's disease, if you have pretty severe inflammation at the end of your small intestine at that time, or strictures, that could occlude more and cause obstruction, which would be a life-threatening concern. And so we would want to make sure that you're doing it safely, not leading to something like that.
Definitely.
Yeah.
Now, out of curiosity, how is the Helminthic therapies done?
Yeah, so it depends on which type you use. So one of the more common ones that I use is one called Necator americanus, and that is pretty easy. So that one, you get sent 2 small vials, and in one of them it just looks like saline, can't even see it, but the helminths are in there, they're microscopic. You just pipette it out. They send you a little pipette, pipe it out onto a piece of cotton. And then there's a second vial that actually has saline in it. Pipette that saline, put it in the one, rinse out the one that had the helminths, make sure you got everything, put that on the cotton, and then you just stick it on your skin and you wait. And so you can start to feel a little bit of itchiness on the skin, and sometimes we'll have a little bit of bumps of where the helminths enter the skin. And that's all you have to do for that one. The others are typically done orally, again, microscopic, so you're not seeing them. It's just the idea that you are using worms. That is the more ick part, I would say.
So you don't have to visualize like a 6-inch tapeworm.
Oh, no. Yeah, that would make it much harder to convince patients. Yeah, no. And then in the Necator americanus, the one we do on the skin is the most common one that I use. And with that, so I have actually done it myself, just to try, because I like to when I can, when it makes sense. And one of the side effects, though, that is pretty common is that following inoculation, about 5 to 8 weeks, is something called the worm flu. And so you can get flu-like symptoms for a few days a week, usually abdominal symptoms, muscle pain, etc., fatigue, tiredness, and but that self-resolves. If you go a little bit too heavy too quickly, which I have done myself, that can be a little bit worse. And so I typically recommend low and slow. There's no reason, especially if you are treating for an immune condition that is that hyperimmune response, just being cautious and slow. There's no reason to race through it.
Do the helminths, do they naturally die off in your body? Is that why you have to kind of do it multiple times for ongoing maintenance? Is that the idea?
Yeah. So the helminths that we use, none are able to replicate inside the body. So what you take is what you have. So if you take 5, you'll have 5 or less, because things that we consume, whether drugs or even certain foods, herbs, etc., can be damaging to them. So you'll either have that amount or less. They won't replicate inside of you. So that's why we re-inoculate with time, depending on the helminth that we use. They have certain lifespans. So there's some helminths that are a lot shorter in duration and that aren't able to establish resistance, so they'll pass through in 2 weeks. And so that could be an option if somebody's unsure and wants to give it a little bit try before they commit to something that has Necator americanus is a longer lifespan, 1 year, 3 to 3 years. So they can try those shorter helminths, and they typically have less side effects. So it can be what we call a good gateway helminth, the gateway drug, but helminth. So it's something to try if you kind of want to dip your toe in the water. But if you do go with some of the longer helminths, and you decide that you no longer want a helminth, we can easily do a dose of an anti-helminthic drug like albendazole and olive salt. It is gone. It's not like they're difficult to remove post facto if needed.
That is fascinating stuff. Thank you so much for the deep dive into
Yeah.
Helminthic therapies.
Yeah, absolutely. I can share those studies as well.
Please, yeah, I would love that. I'll put all those studies in the show notes so that people to jump in there and take a look.
Yeah, certainly.
So you are with Modrn Med. Can you talk a little bit about the practice and what types of patients you see?
Yeah, so Modrn Med, we are a practice. We are all naturopathic doctors. There's 4 of us there, and we do integrative and functional medicine. A large part of our practice is gastrointestinal disease, including inflammatory bowel disease. I personally see patients exclusively via telehealth. Um, and myself and one other provider exclusively via telehealth, but there is a location in LA too if people are interested. With that, since I do telehealth, I am able to see, I'm licensed in California, Arizona, Maryland, Vermont, and Connecticut as of now. But all of us, depending, can either see you as a patient if we're licensed in that state, or we do what we consider like educational consults. So with patients who live out of state, so we can share some of this information with you and help you do things safely, or your provider happy to talk to them too. We just can't establish that doctor-patient relationship, so wouldn't be able to prescribe, ordering testing, diagnose anything, but could share a lot of this information.
Wonderful. How many states do you think that the practitioners that the doctors in your clinic cover amongst all? I think you said there's 4 of you.
Yeah, I think the other states, so we're all licensed in California. I think the other states covered would be Colorado is the only other state out of what I listed. Yes, I believe that's true. But we do see patients all over, and it is common for us, even if patients are in a state that we are licensed and are able to order testing and make diagnoses and things. Very common with us to work with other providers, especially myself working with gastroenterologists. I think when we all work as a team is when we get the best outcomes. And so patients who may be in a state that we're not licensed in, we're able to or comfortable talking to providers, and usually there's no issues with that as long as we kind of explain what we're doing. We always do evidence-based medicine, so as long as we share, even if they're not familiar with it off the bat, most people are open to working together and kind of helping the patient out.
So you're definitely a great starting point for anyone who's looking to bring in integrative therapies into their protocol overall.
Yeah, absolutely. And if we're not a good fit, I would be happy to find to help point people in the direction that would be a good direction for them too.
So if people want to learn more about Modrn Med or keep up with you, where can they go online?
Yeah, best place to find would be our website. So modrnmed.com, modrn.com. And then from there, you'll be able to find our YouTube channel and our Instagram. And we do share helpful information on gastrointestinal health. And then there's also more information if you are interested in working together for next steps to set that up.
Perfect. I'll put those links in the show notes as well.
Awesome.
And then as we get ready to wrap up, what is the final message or piece of advice that you would like to share with listeners?
Yeah, I would just say that there are other tools out there that can be helpful and are backed by science and safe to try. And so if you're not having the desired response that you are looking for from some of the things that you've tried so far, that there is hope, there is other options that you can consider, and that we can work together to find those and figure out what's best if you're interested.
Well, thank you again so much for giving us a deeper insight into the naturopathic world and sharing with us about so many different topics, things that I'd really never heard about, and taking us a deep dive into all of those. It was truly a pleasure. So thank you so much for coming on.
Yeah, absolutely. Thank you so much for having me. It was a great time.
Thank you for listening. If you love these interviews and want to support the podcast, visit my website at crohnsfitnessfood.com, where you can browse my featured products page to shop the companies I love and support. Make a donation using the Buy Me a Coffee link to send a little love, or grab a copy of my book and IBD story, Crohn's Fitness Food and My Rocky Road to Health. If you have an IBD story that you want to share, send me an email at story@crohnsfitnessfood.com. And always remember, be strong, be grateful, and keep going.